Hello guys and welcome back to
Scrub Mentality!
I'm Frances.
And I'm Maishin, and today we're going to talk about everything regarding to coming here to Australia, whether you're a recent graduate student or already working abroad. And
let's just make it fun and simple so you would know exactly what to do.
yeah, ready?
Let's go!
So Frances, imagine like you're recently graduated here in the Philippines and then you've got like a dream going abroad or basically Australia someday.
To be young again. So step one is to consider studying nursing directly in Australia. So you have to apply to the different universities here. Or you can also finish your degree back in the Philippines and then apply here.
So make sure that when you graduate from a school that it's CHED accredited, because AHPRA will check your school credentials as well.
And don't forget to need to pass their English exam, IELTS or OAT or PTE with good scores, because they need good English communication skills here in Australia because the primary language is English. And if you need to know more about this, we can make a separate video about it, or we're already scheduled to do another video about this, so you have to watch out.
What about the expenses though? Because I heard Australia tuition fees are really steep.
Yeah, I've heard too, you have to save.
Yeah, so just a rough estimate, maybe around 25,000 to 40,000 a year. So just convert it to the Filipino currency. But don't you guys worry, because I believe there's also some scholarships being offered, also student loans would help a lot as well, right?
Yeah. So once you graduate, you need to register with AHPRA. That's your golden ticket to work here in Australia. In our previous videos, we already discussed what AHPRA is, but we will put the links below if you want to know more about this as well.
First topic, for example, you're a Filipino who just recently graduated from the Philippines. What are the steps?
So what are the steps? What should we do? The first thing is you have to pass the NCLEX exam. Or there are times you can also apply for the CAP or the Competency Assessment Program, so that you can prove to Australia that you can work here, that you're competent to work here, and that they need you here.
Actually, Filipino nurses also go straight to OBA pathway because the Philippines nursing curriculum is different from Australia. So,
because of different curriculums,
yeah,
you have to apply to AHPRA to assess your qualifications. That's why you need to undergo that assessment.
Yeah, and then if it's approved, you have to pass the OBA, which has a written exams as well as the OSCE. Don't worry, we will all discuss everything in this video. So just stay tuned. Just don't cancel the video.
Don't skip.
Don't skip. In my case, for example, if you're a Filipino nurse who just recently worked abroad, may it be in Middle East, Saudi, UAE, there are other pathways which you can also use, but you can also use the OBA pathway as well.
Okay. So the process is similar. You have to apply to AHPRA for assessment, complete the OBA pathway, which they will test your skills, your knowledge. And then, what's next?
So basically, kahit saan ka man nagtrabaho, you have to show Australia that you meet their standards through OBA and OSCE.
And yes, the fees are quite hefty. Expect around 1,000 to 1,500 for the application. That's for the application only.
Yeah.
Plus, you have like 3,500 to 4,000 for the OSCE itself. So it needs a large amount of money. That's why you need to really prepare for it. Except if you're rich already, you can share your blessings to us.
So let's jump off. So what's the OBA pathway basically? What does it mean?
So OBA means outcome-based assessment. It is a test to make sure that your nursing education and your experience meets the Australian standards. So OBA pathway has two-stage process. It was introduced by the Nursing and Midwifery Board of Australia in 2020. It replaced the well-known bridging program. When I graduated, everyone was doing the bridging program, so it was very known in our nursing school. But they've replaced it with the OBA pathway, which I think is more easy.
Yeah.
I mean, not easy in a way, but I remember before when you're in the bridging program, you need to have lots of money
Yeah, you have
and
to
all that. Yeah.
make sure you've got like $500,000 in your credit
Yeah.
card or something.
before you can apply for it. So it's to assess whether you have the knowledge, the skill, and the clinical judgment to practice safely and effectively, of course, as a nurse in Australia. So they're very strict, but it's to make sure that we're providing safe care to
Of
patients.
course, yeah, of course. I think everyone needs that
Yeah.
one. So who needs OBA pathways? First, you need to follow the OBA pathway if you are a registered nurse in the Philippines. You have completed a Bachelor of Science in Nursing, and then at least you have 1 to 2 years of experience, clinical experience. It is recommended, but sure it is not a must. So you can still apply for an OBA pathway if you don't have experience,
you
which
can
is a
apply,
good thing. Yeah.
for fresh graduates.
Yeah. So you don't have to like be stressed. Oh, I don't have any experience. Am I allowed
Yeah.
to? Yes, you are. And then
It's just, I think maybe if they just recommended it because when you apply for jobs, they will, of course, the employers will look for someone who has experience. So
Exactly.
you can manage that in your own time, like get the OBA first and then experience, or do it at the same time. So it's up to you.
yeah. At least if you can, try
Yeah.
to have an experience. So, how to process your OBA? So, step-by-step process, we'll try to do it as much as clearly as we can because it's quite a lengthy process. But just bear with us, guys. So, first one, bear with us. So, first one is the AHPRA self-check. First, you have to log on into the AHPRA's IQ&M portal, wherein you will register and enter your qualifications. Sorry. So you will have to register and then you have to enter your qualifications, and then you will be streamed to and assigned to Stream B, which is the OBA required. Then you will be guided through create an account with Epic, and then wherein you will verify your credentials like your diplomas, license, transcripts, all of that. I heard a sound. But yeah, so basically all your important documents, you will upload it on that site already. And then this next step will be
Step 2 is you have an orientation part, which is an online module. It's a free online course with regards to Australia's healthcare system, laws, ethics, and patient safety. So basically just how we will practice nursing here in Australia, and must be completed before sitting your NCLEX exam. So it's a prerequisite before doing your NCLEX exam. And then after that, if you've done that, you can now go to step 3. After you've done the orientation, you can now register to take the NCLEX. So what is NCLEX? It's very familiar because US has NCLEX, Australia has their own NCLEX too. So it's a computer-based exam that will test your knowledge and skills theoretically. So it is administered by the Pearson VUE, and it can be taken in Manila or other major cities.
Yeah.
So the format of this test, it usually has 75 to 145 questions, and it will take you up to 5 hours.
feels
So you-
like a lifetime.
I know. You must apply to AHPRA, and they will guide you to schedule your NCLEX. So it's different because I think I have a friend who's applying for the OBA pathway. So like what we said, she first did her self-assessment, and then she is currently waiting for the response from AHPRA because she also put her transcripts and everything there. She's currently waiting for the response, and then if they say okay, your transcripts, your diplomas are okay, then they will let you schedule your NCLEX. So it's a very organized, systematic approach to help the nurses as well.
Me personally, I did NCLEX before as well. There are
US, yeah.
US, yeah. But it was back 2020, so I think the process is way different right now. But trust me, you really need to study with regards to this one.
Not like PTE, 2
You know.
weeks.
NCLEX is really hard, guys.
So there
yeah.
are so to help them with NCLEX, there are a lot of review centers
yeah.
available for everyone. They have the Rachel Allen, the RA Gapus, the U World. They have what do I hear? iPass.
Yeah.
They have loads of review centers now, Top Rank and all that. They can help you pass the NCLEX.
And then, obviously, if you pass the NCLEX, you will have to proceed to the most dreaded part. I mean, for me. Is it okay for you? I mean, we both did
Yeah.
OSCE.
It's for everyone. I don't think
Yeah.
it's
So you have
the
to move next to the OSCE, which is a practical exam where you demonstrate your nursing skills live. So it's basically like a counter demonstration for us nursing students before. So how to pass it? It is one of the toughest parts while you go through different stations.
Yeah, it's a station task.
Yeah. So back in the UK, me and Francis did it before we were able to practice nursing back in there. So it's a practical face-to-face exam, which is unfortunately gonna only be held here in Australia. I think
Yeah, you have to go
yeah,
here.
you have to really come here in Australia. I think Adelaide or in South Australia.
Yeah.
Unfortunately, there's still no facility that processes OSCE back in the Philippines.
But like in the UK, for the OSCE, right? We have to go really to the country and
Yeah.
do it. I
Yeah.
think that's what really you have to do. Same as in Australia.
So OSCE is a test of your ability to perform nursing tasks in a simulated clinical scenarios wherein you will be able to administer medication, do wound care, patient communication.
Yeah. You remember in the UK, what did we do? Aseptic techniques,
Yeah.
catheter change, and all that. So it's random. They're
It
gonna give
is.
you random tasks per station. So you just have to prepare. Yeah.
There will be at least 10 stations,
Yeah, wow.
about 10 to 12 minutes each.
I can't breathe.
I know. So it's conducted on a health simulation center, which is basically in Adelaide. And yeah, there are schools also that help you prepare for the exam. Some of this we will post in the section below, which includes IHNA, ETA, and the APNA after OSCE coaching. Some review centers in the Philippines also, though, offer mock exams for OSCE, which is very helpful, I think,
Yeah.
because you really need to prepare for the OSCE.
Yeah. It was like in the UK we have what we call boot camps.
Yeah, yeah.
And then we'll have like someone who will teach us, and then we can freely practice with our batchmates in there, cohort mates. We can practice the different tasks, but probably the same thing here.
Yeah. So it feels really like an exam, like, during your board exam days, the feel is just literally the same, but it's more like a different pressure because you are tested live.
Yeah, and I
With
think
cameras.
Yeah, with cameras. And I think your enemy really on the exam day is your fear, your anxiety. That's because once you're like thinking of it too much, sometimes you have brain fog, you forget about the smallest things. But luck with study, with prayers, you can never go wrong. So yeah, in my case, I did that. I was just blessed that I had like a kind instructor,
I know,
a
me
kind
too.
instructor that I didn't feel like she was very strict. So I let my guards down and then just did it in one go. So that was my UK OSCE experience. How
I
about
remember I did a wound dressing.
you? Same.
I had a wound dressing. It's actually the last part of my exam, and then I forgot to put the dressing on.
So it's a wound dressing task.
So I was about to close the wound already, and then I only have like 2 minutes left on my clock because, guys, it's a time exam as well.
They have time.
So I forgot to put the dressing
Limits.
on, and then my instructor test. How do you call them?
Yeah, like instructor,
Instructor,
chest instructor,
anyways.
yeah.
And then he was like, "Did you forget something? You're gonna close my wound already." And I was like, oh, I was dumbfounded because, oh my God, the dressing is still in there. And he was like, it's okay, Mason, calm yourself down. He was like, if you're in the A&E setting, just tell me, just don't do it, just tell me. So I just have to tell everything.
Oh, that's good.
But
You
he
were
was
lucky.
very nice.
Yeah, but sometimes it depends on the one that's conducting your demonstration.
I know. So
yeah.
when I got the result, I really cried because I thought I'm gonna fail. So can you imagine if you fail the OSCE?
We had the same wound dressing, but my mistake was I didn't clean the top. The top. It's from the beginning. It was already a mistake. But the instructor was happy to like, oh, what did you forget to do before you do that?
Yeah.
And then
They're sort of friendly as well.
I think you just have to fight the fear and just go through
I
with it.
think maybe as long as they see that you know the basics, they will
And then
pass
don't
you.
forget to, even though, because I've noticed, even though you don't do it, but you mention it, like I asked the patient what are his allergies and all that stuff, they would still consider, even though you didn't do it actually. So if you
Yeah.
lack time, you can always just explain like what she did on
just
her.
explain.
Yeah. You want to go get back to
I don't want to be on that position again. But yeah, just practice a lot. Then join OSCE review classes. There are lots of online classes online where you can like familiarize yourself with the Australian healthcare and also the culture because it's different
It's
as
different.
well.
It's
Yeah.
different. So on the exam day, just be calm and confident. The nervous feeling is your enemy, really. But just imagine you're caring for a patient in your local hospital. It's just like a normal day. I know it's easy to say, but you have to set your mind, mentality, scrub mentality.
Scrub mentality.
Put your mindset in there, and then you'll do good as long as you study, really.
Yeah. So, once registered, you apply for the skilled migration visa, which is the temporary skilled shortage visa or the employer nomination scheme. The types of visa, which we already uploaded on a different video.
So go check.
So don't forget to check. Yeah.
So just a tip, you connect with the Filipino nurse groups in Australia through online. There's lots of Facebook groups or Facebook pages. They can help you find jobs and adjust faster. And if you have any questions, out of 1,000 members, somebody will answer. And somebody may have experienced the same thing you're
Exactly.
experiencing. So if you post it there and ask for help, it wouldn't hurt. It might help you as well.
Yeah.
And you have to prepare well for the English test and OSCE. They always say prepare for your
know.
English test, right? But as I've experienced, you have to practice because practice makes perfect. The motor memory, when you always do it, you will remember it on the exam day.
Yeah.
Yeah.
Try to practice it on your body, like just a friend. Like I remember I was practicing it with even my husband and him, or just a dummy or adult, just practice.
See, you've passed.
I know.
It paid off. And also, other than preparing yourself with your knowledge, you have to prepare financially. Aside from the exam fees, in the previous videos, the visa processing can cost you a few thousand Australian dollars. So having a money on the side while doing all of this or saving money will really make things easier for you.
Exactly, yeah.
So just to summarize,
Yeah.
for Filipino nurses, the key steps for the OBA pathway is first, you have to register with AHPRA. Second, you have to pass the OBA written exam or the NCLEX. And then third is pass the OSCE practical exam, which can only be done here in Australia.
Unfortunately.
And then to start working, you have to apply for a visa. And there you go. So as of April 2025, AHPRA has introduced a streamlined registration pathway for internationally qualified registered nurses, or the IQRNs, from specific countries. That's including the UK, where we
Yeah.
came from, United States, Singapore, Canada. These changes aim to expedite the registration process of those eligible nurses from these different jurisdictions.
So it's a good news for nurses working in those specific countries,
Countries,
right?
yeah.
So,
Bad news for 2017 graduates and below.
I know, because it's just, what are how to register on this pathway specifically for nurses from these specified countries. First, you should be eligible. There's an eligibility criteria for streamlined pathway. To qualify, you must hold a valid nursing registration in one of the approved comparable jurisdictions, basically from the UK, US, Singapore, or Canada, which is British Columbia or Ontario.
Yeah.
You also have to make sure of this one, you have to complete 1,800 hours of clinical experience within the past 8 years in the approved jurisdiction. Yeah. And also demonstrate English language proficiency by passing the OET, IELTS, or PTE.
Just unending English proficiency test.
Wherever you go.
So applicants meeting this criteria may bypass the OBA pathway that we've just discussed. which, like we said, includes NCLEX and OSCE. So this pathway, the streamlined pathway, is a faster registration.
Did you remember it recently just opened April this
Yeah,
year?
April. We heard the news. I think AHPRA was giving hints, and then it really just, I think they made it official in April 20. For application process overview, so for the overview.
Just a rundown, yeah.
Yeah. You have to do a self-check in AHPRA website. So by completing a self-check in AHPRA, you can determine if you're eligible. So everything you need to do, they're already in AHPRA.
You just log into AHPRA. They're very straightforward. Yeah.
Then number 2, you have to submit the documents.
Again.
To submit the necessary documents, so your proof of identity, the usual thing, your qualifications, your registration status, and then your evidence of clinical practice hours.
Yeah.
And the third one is the unending English proficiency exam. So submit a valid, active English language test result. And then fourth is you have to have a registration decision. So if you're successful, AHPRA will grant you registration, allowing you to practice in Australia as a nurse.
So just things to remember, the streamlined pathway is designed to reduce processing time significantly, with some applications being processed as little as a month.
Wow.
So can you imagine?
That's really fast when
I
compared to
know.
like NCLEX and OSCE. Oh.
I know, you'll be here in like
No time.
Yeah. Nurses also from this specific jurisdiction are not listed, or those who do not meet the clinical practice requirements will need to undergo the standard OBA pathway.
So if you don't meet this,
you have
to
to
go to OBA.
Yeah.
Okay?
And also, it's essential for us to ensure that all documents is accurate and complete to avoid delays in the registration process. Remember, this is a computer, so they know how to do everything,
Checks,
guys.
yeah.
They know how
You have to be
trust
honest.
them.
Yeah, just pass
Yeah.
your documents
Don't
properly.
forge your documents. Honesty is the best policy.
So if you need assistance with the application process or have any specific questions, feel free to ask, comment below, or send a message to us. We will try our best to help you, as we always do.
It's a long journey, but it's totally worth it if you try to look it on a brighter side. It's better work conditions here, guys, in Australia. Better pay, definitely. And obviously, it's a much better lifestyle that we have back home. You will feel it once you're here already. So I guess that's it. So if you find this video very helpful, which I hope you do, hit the like button and subscribe. And then for more nursing career tips, we've got lots in store for you.
Oh yeah, as always, comment down below if you have any questions about the OBA pathway. We'd love to help. It's not what we used, but we will try our best to research and help you, and ask friends who are applying as well.
Yeah.
So good luck, future Aussie nurses. See you here.
Bye.
Thank you. See you
Thank
next
you.
time.